us move on to the next talk that is presented by Professor Afiquor Rahman from Bangladesh. He's going to talk us on strategies for reducing the risk of surgical complications in endourology. Over to you, sir.
Honorable chairpersons, respected audience, very good morning. I am Professor Afiquor Rahman from the land of Royal Bengal Tiger, Bangladesh. These are the medical college hospitals in different regions of my country, where is my working place. My talk is on strategies for reducing the risk of surgical complication of endourology. We know what is endourology. This is the open road, very easy to walk. There is like open surgical procedure. Chances of complications are less. But walking on roof, very narrow road, very difficult to walk, like endourological procedures, where chances of complications are more. We human beings are very much interested to share our success than failure. Success stories give pleasure, but failure teaches a lot. So we should share our histories of failure so that we can learn from there and chances of complications will be less. Each and every complication should be thoroughly evaluated and we can understand the cause like autopsy, so that in upcoming procedure, we can prevent the complications. Common endourological procedures, we know, erythrocystoscopy, VIU, TURP, TURBT, litholapexy, URS, ICPL, RIRS, PCNL, and robotic and laparoscopic procedure, laser ablation of the prostate, laser inoculation of the prostate, aqua ablation of the prostate, urolope, robotic assisted nephrectomy, partial nephrectomy, radical nephrectomy, nephroureterectomy, and cystectomy, and so on. We use some energies in our endourology: ultrasound, laser, electric cautery, pneumatic, and fluoroscopy. Some equipments we use, these equipments are C-arm, radiation protecting equipment, light source and video recorders, lithotripsy devices, laser ultrasound and pneumatic, endoscope, rigid and flexible, disposable elements, guide wire, ureteral catheter, stents, dilator, and baskets. Complications may be divided into immediate, early, and late. According to AUA and EUA 2016-2022, intraoperative complications 3.6%. Among these, mucosal injury, ureteral perforation, significant bleeding, ureteral avulsion. Early complications 6.1%, fever and urosepsis, persistent hematuria, renal colic. Late complications, ureteral strictures, persistent vesico-ureteric reflux. Complications of endourology: if you think erythrocystoscopy, there will be false passage, injury to the normal urethra, bleeding, injury to the sphincter. In TURP and TURBT, bleeding, perforation of the bladder, sphincter injury, clot retention, TUR syndrome, ejaculatory dysfunction, urinary incontinence, infections, stricture formation, blood and neck contracture. And in other endourological procedures like URS and ICPL, perforation of the ureter, mucosal injury, avulsion, that you know. In PCNL, again, bleeding, these are the complications there may be. There are some factors which are very much related with these procedures. So the factors should be taken into consideration if we want to prevent complications. These are characteristics of the patient is important: age, sex, and comorbidities, surgical approaches, type of medical devices we use, experience and skills of the surgeon, very important. Types of energy we use, time of the procedure is very important factors, and coordination of the team is again very important factor. Among the endourological procedures, URS is one of the most common. So there are some challenges, and these challenging areas should be taken special consideration. Otherwise, complication will be more. Stone retropulsion, impacted stone with hydronephrosis, tortuous ureter with unusual angling, presence of mucosal edema and inflammation, tight distal ureter where it will be difficult to reach the place, high stone burden, that is long time may be required, ectopic ureter and implanted ureter, very difficult to negotiate the guide wire even, large prostate with protruded median lobe, create some problems, so we should take care here. And there are complications also in this procedure. Prevention of complications, again bleeding, guide wire use should be very careful. Hydrophilic guide wire should be used. Use of syringe for irrigation. Avoid high intrarenal pressure. Don't force ureteroscope. In case of laser, avoid mucosal injury. And in case of uteral damage, small caliber endoscope should be used, safety guide wire should be used, avoid contact of the lithotripsy to tip of the ureter, avoid high pressure irrigation fluid. If stuck, remove it gently. In developing the strategies of prevention of complications, there are some limitations. No authentic data is available, no clear protocols are available, most are based on studies of low-level evidence. Good clinical practice recommendation is required. Efficacy of preventive measures remains poorly investigated. Improved standardization is needed. Quality publications are warranted. Recently, European Association Urology Guideline Committee recommended urgent need of the study of these issues. This is my last slide. Areas to be taken into consideration to prevent complications in endourological procedures. Training of the persons is very important. Well-organized team is very important. Proper diagnostic workup is important. And all these things should take into consideration. Finally, endourology is a teamwork, like cricket match. Contribution of each and every team member is very important. So to prevent complication in our endourology, we should be very much careful. Thank you very much for giving me time.